Welcome to What the Health, Confessions of a Black Nurse, the show where the drama is real, the stories are uncensored, and HIPAA is always respected. I'm your host, Delilah, and if you think your family can't get any messier, trust me, you haven't seen anything until you've stepped inside of a hospital waiting room. Buckle up, because on today's episode, we're talking about what happens when families collide in the hospital. We've got tears, side eye, passive aggressive snack runs, and more opinions flying around than at a family barbecue. If you ever wondered who's really in charge when a loved one gets sick, the patient, the provider, or that one aunt who reads way too much WebMD, this one's for you. So go grab your tea, because we're about to spill some on what really goes down when family drama meets hospital drama. And don't worry, no names, no shade, but plenty of lessons, maybe a laugh or two along the way. Let's get into it. So, there are many different types of family dynamics. There's pretty much four basic categories that everyone falls into. You are either the one, supportive and unified family. You are the conflicted and divided family, the overprotective and controlling family, or just the plain out absent and detached family. And there is one more that I'm going to bring up. It's the cultural side of every family that you also have to take into consideration. The reason I picked family dynamics for a topic is because, as the Black nurse or a new nurse or a nurse on the bottom of the seniority list, you always end up with the difficult families, the difficult patients. Sometimes they're called the heavy patients. A lot of time it's because of lack of knowledge or just the shock of finding out that a close loved one has a health problem that you knew nothing about until it, has been around for a minute or is beginning to advance. One of the most common families that we see is the supportive and unified family. This is a family that communicates well. They respect the patient's wishes despite what their wishes are. They're great families and patients to work with because it just makes it easier for us to collaborate and work with them to make sure that the patient's goals are met. And it decreases tons of stress on the staff. Then we have the complete opposite, which is the absent and detached family. This is a family who's disengaged or just not involved, or there is limited or no family. There are many more people than you believe who have outlived their children. They've outlived their spouse or their significant other. They may have been an only child, or they've outlived their siblings. And so they just don't have the typical family support system because of how long they live, or their family is just not around. They may have extended family, but for whatever reasons or whatever family dynamics they have going on, they're not present. Then you have the conflicted and divided family. This is a family that disagrees about treatment. This is the family that doesn't trust doctors, doesn't trust medical facilities. They typically have some type of family history or cultural history that leads them to feel this way. It causes many delays in treatment and delay in care because they have difficult times making decisions. And it just increases tension because time is always of the essence when you're talking about someone's health. The sooner that we can start addressing things, the better. So then you have the overprotective and controlling family. This probably describes me as the family member the most. I'm very protective of my siblings, my children, my spouse, my parents. anytime that they're in the hospital, I'm like on the phone if I'm not there, or I am calling constantly. I feel like I've realized that a lot of the overprotecting and controlling family members, a lot of them tend to be in healthcare in some shape or form. They're either providers or practitioners or nurses or social workers in a hospital setting, or healthcare setting, or they may be some type of therapist, like a physical therapist or respiratory therapist. But those are usually the overprotective and controlling people, because we know what can actually happen in a hospital if no one's paying attention. If the staff feel like there's no one that cares or things like that, you kind of are the patient that anything could happen to. And we also are just trying to make it known that we are watching a lot of times. And it just comes off as overprotective and controlling, which we probably are being, but I'd rather overprotective than absent. Okay. These dynamics are not just things that I've learned in school. These are real life experiences. So we're going to talk about in our next segment some examples of all of these families that I have either witnessed or been a part of, or was the provider or practitioner or nurse in one of these situations. So we'll be right back. All right. So we're back and we are going to get into it. But I just want you to think for a second. Imagine if you are a nurse and you're walking into a room and there is two sisters facing off because their mother does not want any aggressive treatment, but one sister wants everything possibly done, the most aggressive treatment that there can be, despite the odds or how to make our mother feel, or the mother feel. And the one sister that wants to just respect what the mom wants and kind of leave it at that. It is a awkward situation to walk into. Sometimes you wish you could just go sit in the corner in the room with your box of popcorn and just watch it all play out. But we have to always bring the focus back to the most important person in the whole scenario, which is the patient. And that's how it impacts the patient the most. When families don't agree, or there's a weird family dynamic going on, the person who pays the most is the patient, for a variety of reasons we'll talk about in a little bit. But I want to just give you a few stories. The first story is going to be the conflicted family. I unfortunately have taken care of many conflicted families because I've done hospice for a significant amount of time during my career. And not just hospice, I've also worked in high-level care areas in hospitals that at times you have bad outcomes, or people are at the end of courses of diseases. I've also worked in long-term care where people die in long-term care facilities because sometimes that is their home, or they die during the rehab process. And so, I've dealt with many conflicting families. One of the families that stands out the most to me, the mother, was admitted to the hospital. She had repeated hospitalizations over the last, I'd say, 2 to 3 years. And during the repeated hospitalizations, the doctor was making it clear to the patient that her disease was progressing, and that they were getting to a place where the treatment options were limited, that she was going to become more and more symptomatic because she was at the end stage of heart failure. So of course, the mother goes home, gets her children and things together to let them know the current state of her health. And while she's telling them what her wishes are, which is nothing aggressive, which seems to be what her choice has been for quite some time, because up until um, the end of the disease process, she never did anything aggressive. She would have tests and take medications and follow the diet, participate in rehab, but anything that was invasive was pretty much off of the table. But now, because some of her children, she has multiple children, some of her children are not at a place where they're ready for her to not be with them much longer, or because of their lack of knowledge or lack of knowing their mother's wishes, or because of their own selfish reasons of not being ready to continue on without their parent, they don't agree, and they verbalize that very clearly. Some of the other siblings just said nothing. I don't know that they really agreed or disagreed with their mother's opinion. They just chose to go with it. And then some of her other children were like, if that's what you want, that's what it will be. They decided on who would be the decision maker, things like that. Problem is, no paperwork was ever completed. The patient never put in a power of attorney, these are things that she wanted done, these are things that she didn't want done. When the family agreed on which sibling would be the decision maker, they all agreed in that moment, but there was no documentation or no like power of attorney completed, so that if their mother could not speak, that the physicians would automatically be directed towards them. So this family got to the point that when their mom was hospitalized, because the heart failure progressed to a point where she had eventually had a stroke. And she was pretty dependent after the stroke and ended up going to a rehab facility. While family kind of made some decisions. While at the rehab facility, the children don't agree, to the point it becomes a physical altercation about the care of their mother or the care of their mother's end of life care, and just not agreeing. And I'm sure it wasn't really all about their mom. I'm sure these were some long-standing issues, but it all came to a head when they were starting to reflect on their grief or their loss or the loss that was coming. It manifested as anger, to the point that they're physically attacking each other, to the point that police are called to the facility, to the point that day or so later, because half the children agreed on one thing, half the children agreed on another thing, part of the family that agreed to not do what their mother wanted, they chose to have them moved to another facility, but under an alias, so that none of their other siblings that did not agree with what they were choosing to do could undo anything that they wanted done. And this patient ended up having a lot of aggressive things at the end of life that probably did not increase the quality of life, and in the end was never anything that she wished for herself at the end of her life. But that's what happens when families are conflicted and communication is not clear and documentation is not completed, because of that, the person that the patient wished to make decisions for them never was able to, because she would have respected her wishes and not the wishes of the other sibling. So that is a extreme case of a conflicted family. But yes, I have seen this conflict happen more than I care for. Not necessarily to the point where people are physically fighting and police are called to the hospital, but it has been to the point where there's some yelling and shouting and security is called. There's been times that patients' families are not allowed to visit at the same time, or we had to put restrictions on visitors and things like that because of behaviors. We've had to get really strict with, this is the only family member that we're talking to. She needs to be the spokesperson, because we can't just keep stopping everything we're doing to communicate to all these different family members that are constantly calling, whether the patient has given consent for us to talk to you or not. Yeah. So that is the conflicted family. And quite frankly, they make you feel like you need a referee and a whistle and a white flag or a red flag to throw every time it gets out of hand. Then you have the the unified supportive family. And I'm part of one of these families as well. I have a sibling that had breast cancer, and once she found out what was going on, she just immediately decided, I want a total mastectomy. I want everything gone. You know what I'm saying? I don't, that's what I want. No hesitation, didn't want to think about it. And, that seems a bit extreme, especially because she was quite young when she got this diagnosis. We still said nothing. That her mind seemed to be made up. Obviously, she's thought about this longer than the rest of us. She's living this. So we just supported her decision, showed up for surgery, made sure that at every step of the way, her wishes were being met, which was she wanted the minimal amount of surgeries as possible. She wanted a complete total mastectomy. I'm sorry. And we just really just supported that. We were there when she could not speak for herself because she was in surgery or in too much pain or something like that. We made sure everything, when we advocated for her, we made sure everything that we advocated for was what she wanted and what she was told was going to happen, which did make everything a very pleasant experience. So we were probably very disillusioned when we relived it again about 5 years later with my brother, but it was not breast cancer, it's brain cancer. So then you have the overprotective family. And when my brother got his diagnosis of brain cancer, we definitely became the overprotective family. Every time he went to the doctor, especially in the beginning, it's like there's 5 of us, and my 2 parents. All 7 of us were on the phone with the doctor at the doctor's appointments. Half of them went to the doctor's appointments. I was usually always on the phone because I live in a different state than the rest of my family. So it was, we were very overprotective. We probably had way more questions than him. I'm sure he always appreciated us asking the questions and being present, but I'm sure it was also very nerve-wracking for him at times too, because I think he did feel like at times he was having to make a decision based off of how the group felt versus I don't know that would have always been the decision that he made for himself if we were not always there hovering. He was our joy, and we're very close, the 7 of us, probably to a point that we're a bit invasive in each other's lives, but we are very protective of each other, probably me more than any. I always speak up. I'm always asking questions. I'm always making sure things are heard. Even if I know the answer to the question, I still ask the question because I know there's other people present that don't know the answer to the question. Yeah. So the problem with the overprotective family, you just got to make sure that you keep it respectful. And this is also with the conflicted family. Patients' families don't keep it respectful all the time. They lose that respect a lot of time. And the problem with that is, one, we're collecting all these emotions that you're throwing at us. Typically, in all of these settings, you are not the only patient. Therefore, after the abuse I've just taken for you, I'm still expected to care for your mother with the same standard, even though her guests are treating me like shit. I'm also supposed to just jump when you guys call, which is not the case. And I'm supposed to kind of let you tell me what to do, which also it just doesn't work this way. First of all, this is my place of work, and it just doesn't work like that. Plus, I also have other people to take care of. So when you're putting me in these tense, frustrating, challenging situations, I'm supposed to just walk out your door, wipe the slate clean, and walk into somebody else's room like nothing just happened. That is extremely difficult to do. Do we do it? Do nurses do it? Do doctors do it? Do every discipline that works in these settings do it? Absolutely, because that is our job. That is what we signed up for. And overall, we do understand a lot of the family dynamics that are going on. We understand that a lot of that, what is directed towards us, it has nothing to do with us. So we're just choosing to take it for the moment, but please don't take that as weakness. We are being empathetic. Okay. So we're going to take a quick break. I'm going to grab something to sip on, and then we'll be back and we'll talk about how this challenges the staff and how this actually affects patient care. All right. So the challenge that is presented when you are communicating with staff like this is cut that part out. We're going to start that again. All right. While families are navigating their grief, providers are absorbing a lot of conflict. Nurses may feel like they're caught in the crossfire. A lot of times, physicians may feel like they are experiencing moral distress when asked to continue treatments that go against the patient's wishes. And the emotional toll can just contribute to burnout and dissatisfaction and things like that. And many nurses will say this. They feel like when they're caring for a patient, they're not just caring for a patient, they're caring for the patient's entire family. And I've taken care of, like I said, many of these patients and many of these families over an extended period of time. And it's one of the biggest challenges I face because of the setting my emotions aside after dealing with that patient. Or once I go home, I go home to children, I go home to my significant other. They don't want to moping around mom or wife because of what I went through at work, because that could be my job every day. In the end, when I was a hospice nurse, I knew how my patient contact was going to eventually end in death. And so that is, just something to keep in mind. And then it's very difficult to walk around and act like nothing happened and be polite and respectful and empathetic and compassionate every time we then interact with you. We always seem to be that way with the patient, but when you are the patient and you want us to involve your family in your care, but your family is being extremely disrespectful and rude, that makes that very challenging to do. So, there's this mnemonic that I learned in hospice. Because sometimes things are hurried in hospice because patients get put on hospice at the last minute. And so there's sometimes a lot more conflict if a lot of people didn't know what was going on with the patient prior to the hospice diagnosis. But the mnemonic is calm. And this is how to deal with difficult family dynamics. One, the C in calm. Communicate clearly and consistently. This is one of those situations where you want to over communicate, over check on people, just and be extremely clear. You need to make sure that you're paying attention to your own body language. Every way that we communicate, you need to be on point with it. And make sure that they're hearing you, and make sure that they're understanding you, which you can usually figure out by body language. Acknowledge everyone's emotions, because truly, even though there is a right and a wrong way to deal with people, especially healthcare professionals, acknowledging everyone's emotions is just a good way to make sure everybody knows that they're being heard and seen, and that one person's anger is no more important than the next person's tears or sadness. Then you want to leverage the team, the L in calm, leverage your team. And when I talk about team, I'm talking about the healthcare team. Get the chaplains involved, get the social worker involved, get the any kind of spiritual support there is, get the other nurses involved, get CNAs involved, get therapists involved, keep the patient busy. There's things, utilize the team and there's the tools you have available to you, so that one healthcare team member isn't having to absorb all of that for the entire team. And then mediate conflicts early. You will know when something is brewing, and it's best to just confront it and say, is there a question? Can I explain something a different way? Talk with the patient privately. You can always talk with the patient privately, especially if they are completely with it, as long as they are agreeable to that. And just say, up until this point, your wishes have been this. So I just want to make sure that we're all on the same page in regards to the course of your treatment based off of your wishes. And so just get in front of it, mediate that stuff as soon as you see it coming, so that it doesn't fester and become a bigger thing than it needs to be. So calm, communicate, acknowledge, leverage, mediate. So we're going to take another break, but before we take this break, I want you to just take a deep breath, and I want you to try to clear your head for a second and think about who in your family would be the best and the worst medical decision maker. Don't worry, I won't tell, but this is an exercise that me and my family did when my sister was diagnosed with breast cancer. After her surgery, we were all there and together. So we all sat down and had quite the talk. And it really shed some light on who should be that person and who shouldn't be that person. So I want you to just think about the family members that you have. Think about some of the awful things that have played out in some of the hospital rooms I've told you about, and think about, who do I need to have be that person to prevent these things from happening. All right, we'll be right back. All right, we're back. I also have, I know I gave a question for the listeners, but if you're a listener that is a provider or a practitioner or a nurse, think about a time when you did care for a family in this situation, and how you would change how you handled it in hindsight, because a lot of time in the moment, it's hard to get a hold of yourself, but in hindsight, it is, you learn from the experience, and you really look at it differently. But back to the listeners, when I asked you to reflect before this last break, if you were seriously ill, who would you want making decisions for you? How does your family handle conflict during stressful times? Because illness, no matter how much you know prior to, as you decline, it's always a stressful situation. What does a good death or a good end of life care look like to you? Or what does that mean to you? For providers out there, think back to the time when you were caught in between. Like I said, what might you do differently today? I hope that we would emphasize that family can be both a lifeline and a barrier. Family dynamics in the hospital can be beautiful, painful, or just downright complicated. At their best, families create a circle of love and support that helps the patients through some of the hardest moments of their lives. But at their worst, family conflict can leave patients feeling unheard and staff feeling overwhelmed. I encourage the listeners to approach families with empathy while holding the patient's voice central. It is a challenge, but we can also look at it as an opportunity to find ways to honor the patient's voice and support their family in grief, because ultimately, healthcare isn't about treating an illness. It's about caring for people and all their complexity and differences and stress that comes with that. So we made it to the end of this heavy episode. So this episode, without mentally reviewing your own family's group chat, if you made it through this episode without merely reviewing your own family's group chat, you're a stronger nurse than me. Family dynamics in the hospital go from heartwarming hugs to drama-worthy reality TV. At their best, families are a lifesaver. At their worst, well, sometimes security hears the page before the chaplain does. So here's my challenge. Patient, provider, or the cousin with the loudest opinions, lead with empathy, fight for the patient's voice. And remember, everyone's a little scared deep down, even if it comes out sideways. And next time you sense tension at the bedside, take a deep breath. Try the calm approach. Or picture me in the corner with my popcorn or raising my coffee mug, saluting you. You got this. Thanks so much for joining me for another real, raw episode of What the Health. If you laughed, learned, or remembered a wild hospital family story, hit the share button or spread the word or tell me your story. Please take a second to make sure you're subscribed, and that if you can take another second, leave a rating or review. It really helps everybody find the podcast so that we can share this knowledge with everyone. And just a quick reminder, everything shared on the podcast is for informational and educational purposes only. Nothing here is a medical advice for your specific health or family situation. Always consult a qualified healthcare professional for your own care needs. Drop me a message on social media, or you can even hit me up at the Healthcare Navigator and schedule a consult. But let's keep the conversation going and just maybe make real care for the family. Until next time, be well.